Hi, this is Joanne again. I'm here to talk about my Go React video reflection for task 2 of CPE for D026. So the first thing that I had to do was to search the internet and make a list of strategies to implement value-based care from a nursing perspective. So I was able to meet with the same healthcare quality professional that I met when I did my quality safety position description. So based off on that value-based care assessment tool, according to my manager or my assistant director who accomplished that tool, value-based care has already been initiated in my facility, but because there has been a shift in the leadership, like there's a change in the current director and current manager, and also because of COVID, manpower has been short. So we had to work on the assessment tool in a retrospective point of view. And the 5 action items that we have talked about is to be familiar with the population served or to understand their needs and establish a health status financial metrics for our population. And I work in a rehab facility and we cater to spinal cord injury, amputees, stroke, and brain injury patients. So in order for that to happen, we have to organize care around patient conditions, and we have to value creation occurs when a healthcare provider looks at a patient's medical condition, evaluates potential outcomes and costs over the entire period for that condition, and implements a value-based care approach based on the patient's individual health. The next action item that we talked about is to approve new line programs for population served and allocate resources. So in other words, it's sort of like a bundled payment, and it predetermines the total allowable expenditures for an episode of care. Next is to develop policies and procedures for each line program operation and scope of services. And then to estimate change in type and volume of for services, and by being aware of and the design program in compliance with federal and state laws. So to define the overall scope of services, it will be determined by the location at which a care provider can best achieve high value for their patients depending on their different conditions and needs. And more importantly, one of the action items is to introduce the value-based care performance during internal unit and interdepartmental meetings by integrating learning teams. In my facility, staff were on board. There is full support by the leaders in the management side, by engaging staff through recognition and salary adjustment, which is done annually based off of performance assessments. In addition to that, we also do the employee of the month, and patients and colleagues are able to make recommendations and vote for their favorite staff of the month. So my manager, our leaders acknowledge that embarking on an endeavor of this magnitude takes a lot, and my facility has initiated it, but because of leader changes and lack of manpower, it got stalled. Plus, the change creates a wave, not just a ripple. But she has assured me and the rest of the staff that as soon as the new director is situated and the new manager is situated, and hopefully after the COVID situation gets better, the initiation or the implementation of the value-based care in my facility takes off, and we achieve the full potential of the program, and hopefully achieve the outcomes that we are aiming for. So that's it. Thank you.